Good evening, everybody. Tēnā koutou katoa. Welcome to tonight's talk. Tonight's topic feels very close to home, or may I say, it is actually at home. Last year, Otago Medical School celebrated its 150th anniversary, and lots has happened at the Otago Medical School in those 150 years. Last year, it was King's birthday, if I remember correctly, when the Otago Medical School organized a series of talks, workshops, exhibition, a lot of interest it drew from the crowd. And we thought it would be actually lovely to remember what it was like. So tonight's speaker is alumna herself and Emerita Professor Dawn Alder. I would like to ask you to welcome Dawn to take the floor.
Thank you for coming, and thank you to all those online. I did this talk in preparation for the event last year, and I realized that 150 years is quite a lot of material. So I've tried to focus a little bit on things you might not know about, as well as some of the things that you're familiar with. But I have got quite a big talk, so I do have to talk quite fast. The photo on the left is me in second year, mid, and the photo on the right is my retirement story. But my retirement, I haven't quite got the hang of that yet, but I seem to keep coming back. So medical schools, how long have they been going? Well, in fact, they go back to 1220, University of Montpellier. There were probably earlier ones, but I've just put some other medical schools in there to show you where we fit. So we were 1875 when we were started, and it was really McAndrew who encouraged the university to encouraged the formation of the university and then the medical school. And it was a bit of a risk financially to start a medical school so soon after the university was started because there wasn't much money around. So I'm going to go in 25-year blocks, and I just thought it would be interesting to look at the average mortality and infant mortality over that time period. So when we were starting, the average mortality was between 37 and 42 years of age because of all the diseases that were around that didn't have a cure for, and infant mortality was very high. And the first dean for this period is John Scott. But before John Scott, there was Millen Coventry, and he was the first professor who was appointed in 1876. And Dot Page says in her book that at that time, there was one professor, one student, one classroom, and one cadaver. Millen Coventry didn't stay long enough to have a building named after him, but he did get a street named after him, which is in South Dunedin. He had his first professorial lecture in May 1875. And the thing I like about him was that in this lecture, he said that each lad and girl should, as far as medical education is concerned, be as soundly and thoroughly equipped as those born and reared in other parts of the world. Despite that, at the time when things started, there were an amazing number of New Zealanders who were getting on the boat and going and training elsewhere, as well as these who went and did their whole training overseas. There were at least 60 doctors that I could find who did the 2-year course when it started and then went to finish off overseas. So they then became graduates of the university where they finished off, and so are not named as Otago graduates. But there are some famous names in there, like Mr. Plunkett, Dr. King, and Sir Gordon Bow, who later became Professor of Surgery. But the pink ones are the women. And the amazing thing is there were quite a lot of women who also went overseas and trained overseas. Truby King, he's at the top. The first Maori doctor in New Zealand, Maui Pomare, trained in Chicago, but worked in New Zealand. So Gordon Bell, in his biography, says that in 1905, when I left New Zealand, a raw country youth of 17, Edinburgh was still the mecca for prospective medical students. And there were 17 New Zealanders in his year. and that the Otago Medical School, so this is 30 years after it opened, was a stripling of, and it was making its way, but the day lay ahead when it would be the first choice. The person who started to pull things right after Millen Cuftree resigned because he was frustrated with the lack of financial support was John Halliday Scott, who was employed from Glasgow. He was Dean of the Medical School from 1891 to 1914. You can read his copperplate handwriting in all the minutes and the records of the students that are available in the safe across the way. He was a renowned artist, and we still have lots of his drawings in the Anatomy Museum. And he managed to get a building named after him. So Eleanor McLagan, one of our early women graduates, says that he was the keystone of the medical faculty. He made it, he taught anatomy and physiology, supervised the dissecting, looked after the museum, and he was a good lecturer. People also, other people say he used to come up behind you very quietly and see what you were doing. At the time, there was also Daniel Cahoon, and the theatre across the way is named for him. And Eleanor McLagan gives a fantastic description of him, which I have to read out. He was a widely educated man. At hospital bedside lectures, if he worked his way up to the chair, put one foot on it, and then rested his elbow on his knee, the students sighed. They knew they were in for a 3/4-hour discourse, standing still, shifting their weight from one foot to the other. But what use he made of the little clinical material then available. He would exhibit what symptoms the patient had, what the patient didn't have, and what the patient might have had. And if the patient had had such and such symptoms instead of those exhibited, then the illness would have been so and so instead of what was now the diagnosis. By this time, the student had learned quite a lot or was completely at sea. And I love that. I think that's just a really, you can just imagine the guy, can't you? Going on at the poor students. So what about the students of this first intake? The first, as you know, was William Leddington Christie. He was a school teacher and then went to medical school, and he had to have a wee break in the middle because they didn't have enough teachers to do the whole course. But he was the first one to complete the whole course here in Dunedin. And then he went overseas and never came back. So things haven't really changed very much. And his wife, his second wife, subsequently made a donation for a prize later on. Robert Church graduated in 1892, and that was the start of a succession of surgeons in that family. And it's been really interesting when you look at the history to see how medicine goes through families. So there are 4 male Church surgeons. Everyone but the last one was educated at Otago. Belinda Scott is a great-granddaughter and was educated at Otago, and her daughter is now doing ONG. Emily Seidenberg, the first woman to graduate, we all know about her, but you may not have known that Janet Frame was a baby when she was doing midwifery, and that she commented on her that she was quite noisy or very active or something. She went overseas as soon as she graduated to do further studies in obstetrics and gynecology in Dublin. And so she wasn't the first woman registered in New Zealand. Margaret Cruikshank was. But she was medical superintendent at St Helens Hospital for many years and was highly respected. Margaret Cruikshank, the second graduate, worked in Waimate. She was obviously very intelligent. She had ducks at Otago Girls High School, and she became famous for dying during the influenza epidemic when she was indefatigable in the care of her patients. But one thing I didn't know, that when the Ministry of Health in 2007 did a pandemic preparation, they called it Operation Cruikshank. So the next 24 years, the average mortality has improved a bit. The infant mortality has gone down a little bit. We have Prof. John Scott as Dean, moving on to Lindo Ferguson. And in 1901, it was found the university had exceeded its income by £150 for the preceding 8 years. And when I presented this last year, Grant Robertson was in the audience, and I looked over and said, you probably wouldn't have worried about that too much, would you, Grant? Then came Professor John Malcolm. So he was the first professor of physiology, because before this, Scott had been the only professor, and he had been teaching physiology as well. So John Malcolm came also from Glasgow. He was given £100 to set up the department, and his first impressions were not good. He said, these are the most poverty-stricken set of university people possible to imagine. But he was a renowned teacher, and he was really into nutrition, and he saved the British expedition to the South Pole by giving better nutrition for their dogs, which were doing very badly. And he has a place in my heart because his son and grandsons were both pediatricians, Donald Malcolm here in Dunedin, and then John Malcolm, who not long ago retired from Whakatane. There were a number of academic staff now being involved in teaching in various ways, including bachelor. You remember there was a bachelor ward. We're in Barnet Theatre, and Truby King was doing mental diseases there before he got involved in the Plunkett thing. And then Lindo Ferguson came along. Now, he was an ophthalmologist and the only ophthalmologist practicing in Australasia. So he got around a bit and probably made a bit of money. And he was the person who apparently looked at a class where there were women on the front row and started his lecture by saying, gentlemen. And so people didn't like that at the time. But Frances Preston, who was one of the ladies, said in her autobiography, it's a pity that in our ignorance, we could not at that stage appreciate what the dean's farsightedness was accomplishing for the university, because he had a big picture in his mind. He wanted to expand. He wanted not only a bigger school, but a better one. An interesting thing about him is that he apparently never drove his car in reverse. So he had his garage organized so that you could go in one side and out the other, according to Gordon Parry anyway. And it sounds like this is well how he acted in his business. You couldn't shoot him down. He would go right through the end. And so he advocated very well for money. I always feel a bit sad when I talk about Sydney Champtoloop. He was a New Zealander who went to get his degree overseas and came back to be professor of bacteriology and public health. And he was highly regarded, and his area of research was TB. And sadly, he contracted TB and died at the age of 41. His sister Mary later graduated in 1923. And I was recently, just a few weeks ago, at Anderson's Bay Cemetery to photograph the grave of one of the early women graduates. And just on the way out, I saw his grave there on the side. So that's where he's remembered. But he was very highly regarded. And it just reminds you of the things that people died of in those early days, the things that are now treatable. Lewis Barnett, appointed in 1895 as lecturer in surgery. He was the first New Zealand trained doctor to have a professorial chair. But he had done the 2-year course and then got an Edinburgh degree. He was the first New Zealand surgeon to wear rubber gloves and a mask while operating, which is interesting. He was also an editor of the NZ New Zealand Medical Journal, which started soon after the medical school started, and he endowed the Ralph Barnett Chair of Surgery for his son, who was killed in World War II. Percy Gowland, you know, for second year, I spent a lot of time in the Gowland Lecture Theatre and never knew anything about who that was named for. But he came as Professor of Anatomy from Lancashire, which is where my mother came from. And he was described as an amazing teacher. And John Borry, who wrote about his time as a prisoner of war, remembers getting textbooks, Gowland's textbooks sent to him, which enabled him to prepare for his college exams while he was a prisoner of war. And so people talk about, in their autobiographies, talk about how good his lectures were. I love the bit where Ian Pryor says he had a good sense of humor, and gossip had it that he and Prof. Malcolm would go to the pictures for a quiet and perhaps exciting time away from the stress of teaching students. I don't know if that was really true or not. It doesn't really sound like Prof. Malcolm to me, but it's a good story. And then, of course, with increasing students, you start to get technical staff and laboratory assistants being required to manage the dissecting room and to manage the experiments and the research that started to go on with Professor Malcolm as well as Professor Scott. So what about the students in this time period? Eleanor McLaglen, I really recommend all the books that you see that I've read to find out about these people. These books are great because they tell you about the teachers that taught them, but also tell you about the lives that they lived as doctors. So the interesting thing about Eleanor McLaglen, who graduated in 1903, is that she couldn't get work as a house surgeon. She finally got a job in Northland that nobody else wanted. She worked in the school medical service that was inaugurated in 1912, but a mother of a child said to her, "I'm a trained nurse myself and quite able to look after my child without advice from a woman doctor." She finally got a house surgeon's position at the age of 60, and she was forced to retire from the health department at that age and eventually retired from medicine at 73. Tarangi Hero, also known as Sir Peter Buck, was the first Maori to graduate, and he later worked with Maori Pomare. He had an amazing career in the war and also worked as a chief Maori medical officer in New Zealand, and then went on to a more anthropological interest, working in the Pacific. He was the first Otago Medical School graduate of any ethnicity to be awarded an honorary degree. And he was followed by Tuturuwi Ripa in 1908 and Edward Ellison in 1919. And he has now had a building named after him. Patrick Adair, 1911, I put him in because of his, he specialized in surgery, and he had a son, James, who was a surgeon and is mentioned in Eric Espin's book. And his grandson, Mike Adair, is professor and works in the emergency department in Christchurch Hospital. World War I came along, and the amazing thing is that a number of students went to World War I as students and served at Gallipoli on the ship, came back, finished their degrees, and then certainly Montgomery Spencer went back to be a doctor in the war. So they were getting on boats like you get on the bus here. And Montgomery Spencer later came back and worked as a paediatrician in Wellington and is famous amongst paediatric circles because he criticized some of the Plunkett methods as being too rigid because he was seeing children that were failing to thrive. And the Plunkett idea of when you should feed your child was a pretty rigid one. It did well for many, but not for all children. The Fitzgerald family, some of whom may be watching, I'm not sure, but this is another illustration of how many doctors you can have in one family. And there will be people who remember Beau and Norman particular, but they started out with two twin brothers, and then Gerald, who was a good friend of Montgomery Spencer. And I remember when I was an early paediatric registrar, if Beau Fitzgerald was doing the cesarean section and you were called as the paediatric registrar, you had to go quite quickly or else you'd miss the baby because he was pretty slick when it was urgent. It's good to be reminded of the early deaths that we just don't see now. So William Logan graduated in 1898. He was considered to be a brilliant student and he was going to be a great surgeon. But he had to give up in 1907 because of his health, and he died from mastoiditis at the age of 33, no antibiotics. John Plimmer, who graduated in 1923, served in World War II, killed in Crete. Ashley Howarth, killed in World War I, age 24, just after graduating. Roy Harris passed his final exams in Dunedin, joined the medical corps without graduating, killed in action, age 22. And then some firsts. James Renfrew Wright, the first orthopedic surgeon to get a Master of Surgery degree, and later was a tutor and senior lecturer. Philip Foster, pioneer in neurosurgery in New Zealand, graduated in 1909. Marion White, first lecturer in anaesthesia, Otago Medical School. Winifred Bathgate, 1904, first graduate of either sex appointed to Dunedin hospital staff, became an ophthalmologist. Dusty Allen, first neurologist to practice in New Zealand. Ruth Marjorie Cruikshank Barclay, daughter of the Barclay that Margaret Cruikshank worked with. So I suspect that's why Cruikshank is in her room, first female radiologist in Dunedin. And Thomas Johnson, who was the first person to send insulin over from London to be used on a New Zealand patient. I need to talk about Doris Gordon, née Jolly, who graduated in 1915. She was an amazing powerhouse. She married Bill, who was also a doctor and was based as a GP surgeon in Stratford. But it was because of her advocacy for women's health that we got an O&G chair in Dunedin, an O&G postgrad chair in Auckland, and the Queen Mary Hospital, and later National Women's Hospital. She supported having 14 days free hospital care post-delivery, but the reason she wanted that was that so women would be protected from having to go to marital duties as soon as they got home. She, in midwifery in Dunedin in 1914, there were 3 places where you could deliver. There was St Helens for respectable married women, Salvation Army Refuge Home for single girls, which was closed to students, and the 4th Street Maternity Hospital for fallen women and for teaching medical students. And she said with her friend Francie Dowling, we asked why, if there were hospitals for fallen women, there were no lockups for fallen men. She wrote 2 books and they're very interesting. And then all these books tell you about life as a GP surgeon in the 20s and 30s. Arthur Moody practicing around here, Burns Watson in Southland, David Bathgate at Otira when they were building the railway through, Bill Anderson in Queenstown. I remember as a child when we were on holiday there going to church, and he was at church. He'd been mayor of the town, everybody knew him. And then Francis Bennett, who practiced in Canterbury. And these people working in general practice were working 7 days a week on call. They were often working solo. They would do obstetrics. They had to often be their own anaesthetists. They were paediatricians, physicians, surgeons. They'd take tonsils out and sometimes just do amputations and gynae surgery. Sometimes they had to be the dentist and sometimes they had to be the vet. David Bathgate mentions in his book that there was one woman in his class, but he does not remember her name. So I will remember it for you. She was known as Gertrude Atmore. She graduated in 1919. He says she was charming and neatly dressed, but was more or less ignored by the staff and students, and who apparently still regarded female doctors as odd intruders. Well, luckily, where she worked in Otago, just up from Wellington, she was well respected. She was the wife of the mayor, and when she died in 1959, her body lay on the marae, and it was one of the largest attendances for a tangi on the marae. So she was way ahead of the bicultural thing, and they have a stone in her honor there. I spent a number of years on the board of censors deciding about the Rita Gardner-Gillies scholarship and never knew about her. So she graduated in 1921, and she was a GP in Tuatapere 1924 to 1928. She left initially to pursue more medical training in Karatani care, and then she married a local farmer. She died at the age of 39 from the complications of scarlet fever and diphtheria. She'd had to do a tracheostomy on a patient with diphtheria, and sadly that was the reason she died. And later on, her sister set up the scholarship in her name. She was highly regarded by those around in the Tuatapere area. Frances Preston graduated in 1922. Sorry, I'm going to tell you a lot about the woman. She was the first house surgeon at New Plymouth, and her duties were to give all the anesthetics, so that's 600 anesthetics a year, do all the dispensing, supervise the wards, admit and examine new patients, assess the casualty patients, lecturing to nurses, and she was on call 24 hours a day. Needless to say, when she left, as often happens, they employed 2 house surgeons after that, and a pharmacist. Muriel Bowell, I was embarrassed I didn't know enough about Muriel Bowell. She graduated in 1922 and got an MD in 1926. Margaret Cruikshank was the first person to get an MD, I should have said. And she went overseas and she worked with some reputable researchers and published in the physiology journals of the day. She was the first woman graduate to be honored an honorary degree and the first woman medical graduate made a fellow of the Royal Society. And she was involved in the nutrition committee of the Medical Research Council for many years. She chaired it and did nutrition research along with Prof. Malcolm. But she never, in those days, although the MRC was within the university at the same time, at those days, she didn't progress as we would expect somebody of her mana in research to progress as they do nowadays. But she is also responsible for many of us having milk and skills. Douglas Robb, I put in, he graduated in 1922 and got his MD in 29, and he wrote a very detailed biography about his life, but also medical life in Auckland, which is very interesting. He was a thoracic surgeon and was responsible for starting up Green Lane, but he was also Chancellor of the University of Auckland for a period and really was the driving force behind the development of the Auckland Medical School. But I also like what he said about Doris Gordon, which I mentioned a little bit about as she was a great advocator. No one who knew Doris Gordon, or at least no one who has been used by her for her high purposes, would remain long in doubt about her tenacities and inflexibilities in pursuit of her ends. A mere male, the ordinary peace-loving type, might even be a little afraid of her energy and the services she required. Fear was even on occasions known to develop into alarm as the pressure was put on and the chariot wheels rolled faster and faster. To be of any use to Dr. Doris, you had to be ready to write letters, ring people up, try to put pressure on them, and generally leave your bed at any hour of the day or night. Nice work if you were pleasing her, but not so nice if you were dragging your feet or getting her to change her mind. Some mere males have even been so peevish as to characterize her communications as unparliamentary or even unscrupulous, but these persons take no account of Doris Gordon as a creative woman. Any person, male or female, who can cause to be endowed 2 medical chairs in the University of New Zealand, in addition to leading a full professional business and family life, as Doris did, deserves our admiration and grateful thanks. So I think of the day, that is an amazing commentary from a pretty senior man by that time on a woman. Helen Dean was one of 2 daughters of the first professor of chemistry in Wellington, who went to medical school. Her sister Theo was a physician at Cook Hospital. Helen was the first recipient of the Lady King Scholarship and did an MD on observations on the milk of New Zealand women, and was the medical director of Plunkett really after Truby King, and did a lot to improve the science behind how Plunkett was managing recommendations and the growth charts that were provided. She was also the first woman lecturer in paediatrics here at the medical school and sadly died before her time, age 55, of leukemia, and she has a kindergarten named for her. Robert Aitken was a GP in Johnsonville, and I had to put him in because he did a tonsillectomy on Sir Brian Barrett Boys at home on the kitchen table in Johnsonville when Sir Brian was a young child. There was reportedly an anaesthetist present. I understand there wasn't always much anaesthetic in the early days, but when I saw that, I thought the change of what would have happened to cardiac surgery in New Zealand if that had gone wrong. It would have been quite a different story. In this period, of course, there was the influenza epidemic, and a number of our graduates died during the influenza epidemic. Margaret Cruikshank, the most famous, but there's also a statue for Charles Little, who died at the age of 54. Contrast that with COVID, and the list of people from the medical school are the ones that helped advise on the pandemic, not the ones that died. So going on to 1925 to 1949, again, changes in mortality and are noted, and we move from Lindo Ferguson to Charles Hercus. So Charles Hercus has a building named after him. He was fully trained here in 1914. He did a dental degree first, and he was Professor of Public Health and Bacteriology and Professor of Preventive and Social Medicine, and was subdean and then became dean. He, again, was highly regarded as a man of integrity. He was responsible for setting up the MRC and for getting academic teacher units outside of Dunedin in Auckland, Christchurch and Wellington, the early ones before the big change. He was renowned for apparently bringing lots of papers and books to his surgery, to his lectures, hence the diagram, the cartoon of him behind his books. John Iverack, I've mentioned because he was clearly an important person, and we had an Iverack ward when I was a junior. He was lecturer in medicine and then associate professor, and was also highly regarded. Horace Smirk came and did his blood pressure research. His first love was undoubtedly research. When a strain of genetically hypertensive rats came away, great was his joy, according to David Hay. And then the students from this period, did you know that there was a graduate of ours who wrote a play, The Wind and the Rain, which was on the West End in London for 1,000 performances? I never knew that. He then returned to medicine in World War II and to New Zealand. David Macmillan, who graduated in 1929, was associated with the New Zealand Labour Party, and he was chair of the Parliamentary National Health Insurance Investigation Committee whose report provided the basis for the health provisions for the Social Security Act, so a really major piece of legislation in New Zealand. Like many of our early graduates, he also spent a time as mayor of his local town. And then there are all these people who were our graduates who have been members of Parliament. So William Chappell, the first, Tauranga Hero was a member of Parliament for a while. Jerry Wall was Speaker of the House. Peter Tapsell was Speaker of the House. Bruce Gregory, Paul Hutchison, Isha Verrill, currently still there. Tom Davis in the Cook Islands, and Sione Tapa in Tonga. I had to put this one, and I found Hugh Small, who graduated in 93, and I found his obituary. And this man's a surgeon, right? A general and vascular surgeon. And the obituary said he was careless about personal dress and safety, for it is recounted that he crushed his leg severely with his own car door, set himself on fire in his own kitchen on his daily 3-mile jog. He managed to get run over by a car in Regent's Park and was bitten by a dog in Hatfield. He tended to ignore these injuries, and limping and bandaged would continue with his work. But I'm not sure I would have wanted him fiddling with my arteries. Maybe that was where he was in his happy place. Graham Cowie wrote a book about his life in the Wairarapa. The interesting thing about Graham Cowie is he came from a family of doctors. His mother was a doctor, and her sister was a doctor, and her 3 brothers were doctors. And so the 3 brothers and the 2 sisters had travelled from Winton, where they were brought up in the manse, to the UK and trained all in medicine overseas. And his mother expected him to marry a doctor, but he didn't. And it was good because when the men were at war, she was able to run the practice. World War II was where some of our graduates became famous in regards to surgery, both general surgery and plastic surgery. Recently, the book about Davis Jolly was published, and that's a really interesting read. And he wrote Field Surgery in Total War, which Michael Shackleton later said was still helpful working in Vietnam. John Bowie wrote about his time as a prisoner of war. Obviously, McIndoe, the plastic surgeon, is well known. But you have to remember that if you're going to be a surgeon, somebody's got to put your patient to sleep. And one of those people putting patients to sleep was Margaret Smith, who graduated in 1936. And then there was Cecily Pickerel, who did plastic surgery, and she became a dame, and William Manchester, who started the unit at Middlemore. Cecily Pickerel had the really outrageous idea that if you have a baby recovering from a cleft palate repair, that the best person to look after them would be the mother and not the nurse. And so she allowed mothers on the ward. How outrageous is that? Apparently it worked really well. So with all these surgeons, people have talked about the Garland legacy. I talked about Percy Garland. All these people, whether they were GP surgeons or full-blown surgeons, had experienced Garland, but also they actually did anatomy every day of the week for probably 2 years. So they did a lot of anatomy, because of course there wasn't so much immunology and bacteriology to learn about. And but Frederick Chisholm said that his highly functional anatomical teaching produced excellent all-purpose surgeons who later proved equally capable of treating severe injuries in peacetime or repairing the wounds during war. Some more firsts. Our first Pacific graduate, Ratu Madro Iwi, Kathleen Fee, first Chinese graduate, Herbert Pacey, first New Zealand to become MCOG by examination, Vitalia Satanand, first Fijian Indian graduate, father of Anand Satanand, Alice Bush, first woman FRSCP in New Zealand and a founding member of the New Zealand Paediatrics Society, and Jean Sandel, the first woman to get FRCS. Some more deaths. There was a sister of one of our graduates who died in her final year at medical school in a horse accident. Somebody who was killed, Frank Morton, killed instantly in the Wairarapa, car struck by a train when he was going out to see a patient. Dying of TB is commonly seen. And the very sad case of Alexandra Matheson, who was a house surgeon at Gore Hospital. She broke a bottle of carbolic acid while lifting it down from a shelf and died within a few hours. She was at just age 28. Patrick Isdale-Moore was well known as an ENT surgeon, and he became fluent in Te Reo and Tikanga Maori. But he came back and worked as an ENT surgeon. But what he's famous for, and I just never realized this before, but the cartoon that we've lived with for years around the medical school was drawn by him. And so he was just one of our graduates at that stage. So this is the staff of the medical school in 1940. You can see that Prof. Malcolm was the shortest. Hercus has the most books. There's Professor of Surgery, Bell, Darth, Dawson, Garland, and Smirk. The hypertension man's the one with the long stethoscope. Going back to Brian Barrett Boys, who survived his tonsillectomy at a young age. The thing I like about reading about Barrett Boys is we've always thought of him as an Aucklander, and I've spent most of my career in Wellington, and apparently when he went to Auckland, he was a young, promising surgeon from Wellington who had been at the Mayo Clinic, and people do describe him as particularly gifted. But a lot of these early people who were working were chain smokers, of course, and so he ended up having to have coronary artery bypass grafting by his colleague Alan Kerr. But he really put Auckland cardiac surgery on the map. Don Bevan in Christchurch, well known for setting up the Christchurch medical research. Diabetes was his thing, and he was a professor, and he was one of the first clinical heads between Auckland, Christchurch, and Wellington. Derek North, Don Bevan, and Ian Pryor, with Paul Zimmet, somebody else in the middle. We have to wait till 1949 to have the first Maori woman graduate. She practiced in the mental health area in Nelson and was highly regarded. John Eccles was professor of, he followed Malcolm as professor of pathology, and he went on after he left here to get a Nobel Prize for work that he'd done on conduction in the nervous system. But he inspired Marianne Felenz, who graduated in 1948, to go to Oxford and do a PhD, and she later spent the rest of her career there and was highly regarded as a researcher. Mont Liggins and Ross Howe, well known to obstetricians and paediatricians, as being the obstetrician and paediatrician who did the research on antenatal steroids for preterm lung disease, and which is now used worldwide. And Bill Liley, who was the obstetrician who started intrauterine transfusion. So Eccles in his autobiography mentions these people as his promising students. Over the years, there's been some New Zealand icons as well. So in 1894, the son of the person who set up Greggs graduated, had an important role in the flu epidemic. We had the son of the founder of Spates, graduating in 1923. Kathleen Todd graduated in 1923, became a psychiatrist. She was a member of the Todd family, which are well known in Wellington. And Ruth Adams, daughter of Ernest, graduated in 1949 and became a pathologist. And she is famous because she went tramping with another New Zealand icon, Sir Ed Hillary. And if you know mountain climbing, you know about the La Perouse event and the major rescue when she was a fifth-year medical student and had a climbing accident, and she was fixed up by James Renfrew Wright, the first person to get the Master of Surgery, and came back and passed fifth year. But it's kind of an interesting story, and it involves Ed Hillary. And so when you also look at Ed Hillary, there's been a lot of our graduates who have been associated with Ed Hillary's work in Nepal, people who've gone out there for a time. And Michael Gill, particularly, who's a pathologist in Auckland, has written a lot about this. And this book describes all the people, many of whom are our graduates who went over and worked with Edmund Hillary. Well, we're getting up to 1950, moving on. So Auckland Medical School opens in 1968, and in 69, just 10% of doctors are women. Edward Sayers got a building named after him. He was our next dean. William Adams got a building named after him. He was the next dean after that. John Hunter's got a building named after him. You're waiting for the women, aren't you? He had 2 terms of dean, and he developed cardiology in Dunedin. And he recruited Norma Rescio, Pat Malloy, and David Stewart, who had big impacts on teaching when I was in medical school. So students, 1950 to 1974, David Hay, important in Christchurch. He took Keith Holyoake to task for smoking in front of children, so that's why he gets on. And he's one of 3 siblings who all became sirs, or his sister's case a dame. We produce vice chancellors from our med school for the university. So Robert Irvine comes into this area as a graduate, but also Helen Nicholson, who was a staff member in the Otago Medical School and had her role as acting vice chancellor. In 1957, Joan Chappell graduated. She was New Zealand's first female plastic and hand surgeon, and the second woman in New Zealand to get a specialist surgical qualification. In 1972, she had a daughter and asked for 5 months maternity leave, and this was denied and her job was terminated. Eric Espiner, who just recently died, was Professor of Medicine in Christchurch and was part of the really important endocrinology research there, and wrote about that in his biography, which was published last year. Patricia Buckfield Not many people realize that she asked the research question that started the Queen Mary Multidisciplinary Child Development Study, but she did. She wrote an MD that's 2 volumes, so I had to show a picture of that. And she was teaching when I was a medical student. Janet Irwin, she's amazing because she started her medical school degree. She was the daughter of George McCaw Smith from Rawene. And in 50 years, she got married and came back 17 years later, completed her degree. It wasn't until she was grown up that she realized that her father had a family of children back in Scotland, because he had left and divorced his wife and come away with somebody else, her mother, to work in Rawene. And it turned out that she had a nephew who was Alexander McCall Smith, who you might know writes a few books that are very entertaining. Carol Shand, who has been a GP in Wellington for many years, reminded us that although she graduated in 1962, they were still excluding women students from the 5th year dinner because it was thought the jokes were too bad. That's 1960s, so that's not that long before I went to med school. Mason Jury graduated in 1973, very well-known moral psychiatrist, and introduced the 4 dimensions of well-being, which is now discussed as an important part of our medical school teaching. Margaret Sparrow, now Dame Margaret Sparrow, also a recent honorary degree recipient, really important for her advocacy for access to abortion services in New Zealand and sexual health services. Eru Pomeroy, the first Maori Dean of any campus, and a gastroenterologist in Wellington. We've had a number of missionaries and humanitarians who've been our graduates, and Alan Kerr and his wife were senior New Zealanders of the Year recently for his work carrying on as a cardiac surgeon still in Palestine. And so amazing people that I don't have time to go into detail about. We've had graduates who've become distinguished professors in places like Harvard, Oxford, Toronto Sick Kids, Graham Bidder, huge involvement in development of MRI as it's used around the world, Murray Brennan, surgery in the States, and Gavin Andrews, School of Psychiatry, University of New South Wales, with an H index of 135, which is quite impressive. And also women, Via Papa, Annadale Atherton in the Pacific, Dinah Redaho was one of our honorary degrees last year, Jennifer Cooper, Professor of Paediatrics in Adelaide, Andrea Boone, Terry Inder, Helen Heslop, classmate of mine, all professors working overseas. And we contribute a lot of professors to Auckland Medical School. There's quite a few from 1980, because that was my class, and they're the ones I remember, but there were many more than these. Very sadly, our colleague Alistair Gunn died recently. 1975 to 1999, I have to go quicker, but basically we get into the period where the 3 clinical schools separated, and that was because of the Christie Review. So the students in that period, which were coming into my period, so this is my 3rd year class photo, Dave Gerard, who was an Olympian, so it gives an excuse to talk about graduates who've been Olympians. There have been people who've had other talents. They write books. John Gillies, who paints. Tim Wilkinson, who started the New Zealand Doctors Orchestra. And a number of our graduates play in that orchestra. David Kirk, he was my TI once, captain of the World Cup winning rugby team. Ron Alvidge was actually also a captain in 1948. And Ian Pryor got into the North-South game, but there was no All Blacks that year because of the war. We also had 2 Silver Ferns as well. And I remember when Camilla Lees wanted leave from Paediatrics in Wellington, and I sort of said, why would you want to go away for, you've got 4 weeks of Paediatrics. What could be better than doing Paediatrics? Well, apparently trying out for the Silver Ferns was better than doing pediatrics, and she did very well, and she was a very good girl. So in 95, a big change was that Otago Medical School became the School of Biomedical Sciences, separated from the other schools. Prior to that, we had been one school. And then we need to acknowledge all the non-medical scientists, because in the past, it was medically trained people, in the very early past, medically trained people training medical students. But now we have a health sciences where we have students who are not necessarily medical students, and we have many distinguished researchers who are in a variety of health sciences and science roles. Coming, we seem to have deans that don't last as long as they used to. So we have more on the list now, going from 2000 to 225. The difference between this is we had COVID and we did exams online on Zoom, and had tutorials on Zoom, which was quite good for the hearing impaired because you could actually hear what the students were saying. There's been a number of books written by more recent graduates that I can highly recommend, particularly this one by Timotei Tamuki about his life before he went into medical school at an older age. But I've always found these really interesting to read and recommend them. It's interesting, though, when you look back at the past, because in 1975, there was a little history written, and Gordon Parry had a chapter, Men Who Made Their Mark, and Muriel Bowles mentioned, but there's nothing about the women who made their mark, and there had been women making their mark up to 1975. This slide illustrates the buildings and lecture theatres named after men on the left, and on the right, those named after women. So I want to remind you about the early women professors. The first to be promoted was Molly Marples. That was considered so important at the time. I have to use her original class photo to give you a photo of her. She got her graduated in 1944. Her husband was the professor of zoology, and she already had a zoology degree. She did her MD in 1951, and she was promoted to associate professor in 1960. And she was the supervisor for Sandy Smith's PhD, who some of you will remember, and he published his findings in Nature. So she was no slouch, and she is highly regarded and mentioned in the history of the microbiology department. Barbara Hessler graduated in 1948, well known to people around here, became associate professor in 72 and professor in 84. Margaret Loutet was in the Department of Microbiology, so she was non-medical but part of the medical school, and she had a PhD and became professor in 1991. And Norma Restio, who graduated in 1960, had an MD, became associate professor in 1977, and became Dame Norma Restio in 1992. And Molly Marples, Norma Restio says she saw Molly Marples be a doctor, and she realized that she could be a doctor too. And Norma Restio was very good to me in my training and had faith in me. So this is what I now call the Old Girls Network. And there were all these, if you go through the medical, the yearbooks, as I did, and wrote down all the women's names, there were these, the women I've just mentioned are in red, but there were these other women who were assistant lecturers or lecturers. And Hendrika Wall-Manning had 90 plus medications, publications, working for the hypertension group. Never got beyond senior research fellow. So we have got a place. Emily's got a place named for her. Margaret Cruikshank was the first woman, a medical woman, to get a statue in Waimate, and it's worth going to see that. We've got a bit of rock for Gertrude Atmore, and we have many student prizes. Norma Restio has a room named for her, and Alan Gurr has a general practice chair. So, but it's not a building. We have had 2 women female deans in 150 years. Suze Patama only recently the second one, and we have now had 2 women deans of the Dean School of Medicine. But none of this would have happened without our professional staff. And I love this quote about Miss G. Thompson, the Dean's Secretary. The school was certainly well administrated under the sub-deans of Sir Lindo's time. Not a little of the credit is due to the Dean's Secretary, Miss G.M. Thompson. Miss Thompson, besides using the ordinary technique of an efficient secretary, was quite imperturbable, never fussed by any emergency, could put her hand on any required document or student's record at a moment's notice, and nothing was ever too much trouble to her. She kept the wheels of her department oiled and revolving so smoothly that it was taken as a matter of course, which was not. And that completely, to me, epitomizes Jackie Bradshaw, who's sitting here, who is currently the Dean's Secretary and has many of the same characteristics. And the many people I've worked with over the years who were the same. We have technical staff to keep us going. We have librarians to keep us going. And this information would not be possible without the historians who've recorded the history in the past, and also just to advertise again the Against the Odds book about the first women graduates up to the time of Auckland University, which was published last year. So from 1875 to 2025, anniversary last year, we went from one professor, one student, one classroom, one cadaver, to 137 professors. This is just me looking in the book. 40 were women, 1,578 medical students, 1,941 spaces or classrooms, and there are still cadavers, but we choose not to count them. Thank you.